Hey A&Pers, this is Dr. Jones checking in. This is A&P 1, Lecture Test 2, Video 10, take like 20 trillion. So if this one doesn't work, then I am switching to no video, just audio. So I've called AppleCare several times today, and I've restarted the computer and changed settings, and if that doesn't work, it doesn't work. So let's go over page 16 and see if it records. Still frustrating. All right, so the dermis. We talked about the epidermis, and we need to cover the dermis. So the papillary layer is the superficial layer of the dermis. Let's go with red. Papillary layer, superficial layer of the dermis. And these bumps here are the dermal papilla. They're like fingers, like the parts that stick up in the middle of an egg carton, or like an egg crate, like the mattress cover with the little bumps, like an egg carton. Yeah, like that. And made of areolar CT, contains capillaries, and here's how you spell capillary. Capillaries are the smallest blood vessels where the arteries and veins meet. It's an exchange surface, but we'll get there next semester. Capillaries, lymph vessels, sensory nerves, the most superficial blood supply to the surface of the skin. And of course the bumps are called the dermal papilla, which we mentioned. Dermatitis is inflammation of the papillary layer. Now with dermatitis, you would think it would be inflammation of the dermis, but it's not the whole dermis, it's just the papillary layer. And the reticular layer is the deep dermis, and it's dense, irregular CT with collagen and elastic fibers, and I want to show you how to write with. That means with. So it's from the Latin word con, which I'm told matches the Spanish, which means with. So the C with a line over it is the same thing as W/. And then S with a line over it means seen, which I'm told in Spanish matches the Latin to also mean without. There you go. There are lots of times in anatomy where we find the Spanish and the Latin meaning a whole lot the same and the words looking a whole lot alike, like aqua versus agua. The one that's completely different is the word for white. White in Spanish is blanco, if I'm saying it right, and white in Latin is alba, A-L-B-A, like albino. And the reticular layer, next, is the deep layer of the dermis, and it is made of dense irregular CT with collagen and elastic fibers. So you can write with and without this way in charts, but if you see these in your charts, you need to know what they mean. Next in the boxes, collagen fibers are strong, they resist stretching, they're easily bent and twisted, and by resist stretching, I mean you can't stretch them, like this pencil resists stretching. You can't stretch the pencil. Although unlike the pencil, collagen fibers can be bent and twisted, you just can't stretch them. And then elastic fibers, you can stretch and recoil without damage. I used to show this with rubber bands, and they would always snap. So, yeah. But elastic fibers in the body, stretch and recoil without damage, without snapping, like old rubber bands. Yeah. Excuse me. Skin turgor, flexibility and resilience of the skin, and it depends on the water content. So the test for dehydration is you gently, we're not here to hurt people, especially not ourselves, You gently pinch the skin on the back of the hand, and when you let go, if it stays peaked for a few seconds, then you know you or your patient are dehydrated. So skin turgor and the test for dehydration. Stretch marks is when the stretch exceeds the elastic limits of the skin, and the stretch marks, whether or not you get them, is not determined by how much you spend on fancy lotions. It's determined by genetics. So if you buy these super expensive fancy lotions, they will not keep you from getting stretch marks while you're pregnant. It's based on the genetics. General rule, and there are exceptions to every rule, of course, if you made it through puberty without stretch marks, you have a chance of making it through pregnancy without stretch marks. So good luck with that. Although when you're getting the stretch marks, the lotions do help it not itch so badly. But cheap lotions help it not itch so badly. Vitamin E out of the vitamin E capsules help it not itch so badly. And those are way cheaper than some of the stretch mark lotions. So would I pay extra for stretch mark lotion? Not ever. Would I put stuff on the stretch marks while you're getting the stretch marks so they itch less? Oh, heck yeah, every day, like twice a day. Okay, and retin A is a vitamin A derivative which decreases the appearance of wrinkles. It does not make your wrinkles go away. What it does is swells your skin up so that the wrinkles appear less. It doesn't make them go away. It decreases their appearance. So there you go. And what causes wrinkles and sagging? Well, age. And because you have a decrease of elastin with age. Dehydration, because when you don't have enough water, your hormonal changes by the month. UV exposure tanning gives you wrinkles. And drugs, smoking, and alcohol shows up on your skin in a bad way. I don't know if you're old enough to, if you've been out of high school long enough to have run into people who did not ascribe to clean living the way that you have. You can tell the difference. And wrinkles are not a reason to not do drugs, but it makes as good an excuse as any because drugs are straight up bad for you. Bad for you. Smoking, bad for you. Alcohol, bad for you. Yeah. Pot, fewer people die from pot than from alcohol, but pot's illegal and alcohol isn't. But if you're caught with pot, then you don't get a nursing license. So it's entirely not worth risking everything that you have worked this hard for. And DWIs would probably do it too. I don't know. I'm not originally from Texas, so I don't know what all the rules are, but doing illegal things keeps you from getting your license, from keeping your license. So don't. All right, cleavage lines are now called tension lines. So that's new. Come on, move. Okay. So these cleavage lines are now called tension lines, and it's the direction that the collagen and elastin fibers run in the dermis. So why they're clinically significant is because when you are doing surgery and you're doing an incision, if you do an incision across these elastic fibers, you're going to break all of these tiny rubber bands in the skin. And what do stretched rubber bands do when you break them? Boing! They snap apart. And so that will make a giant, huge scar. So what if instead you cut this way so that you snap as few of those elastic fibers as possible? Then you're going to make a smaller scar and it will heal up much smoother than if you go across. So Every surgeon worth their salt knows these cleavage/tension lines, especially if you have to have any stitches or surgeries or skin cancers removed from your face. You need someone who's qualified to do that and can map those cleavage lines out in their sleep. Okay. Tension lines. All right. The dermal blood supply. The blood supply is in the dermis. The epidermis is avascular. There is no blood supply in the epidermis. What specific layer of the skin has the most superficial blood supply? That is the papillary layer of the dermis is the most superficial blood supply. A contusion is a bruise, so when these blood vessels are crushed or broken, then they bleed out into the dermis, but this is assuming that the surface of the skin has not been cut. You'll have a big old blood bubble inside the skin that you can see through the epidermis, and that is a bruise. Bleeding into the dermis is a bruise, which is a contusion. Bruises and contusions, kind of a bump of a bruise. But okay, and finishing off page 16, and then we will quit this video and pray like heck that it actually records this time. The hypodermis is also called the subcutaneous layer, which is also called the superficial fascia. And why is the skin called a blood reservoir? There's lots and lots of blood in especially the veins in the skin. The skin is the largest organ, and it is very vascular. It has lots of blood supply. So when there is a problem with blood flow, the veins in the skin constrict, they shut down, or they decrease the diameter, so that the blood is forced back into circulation. So when you need extra blood, the blood vessels shut down. That's part of why when you're losing blood, you tend to go kind of white as a sheet, because your blood vessels are shutting down to push that blood back into circulation. So that's why the dermis is a blood reservoir. A reservoir is a storage area for liquids. So, all right, that's page 16. We are going to cut this off here and cross our fingers. So thank you as always for tuning in. It's good to virtually see you here. The education must go on. Dr. J out.